So today we're going to talk about the functions of skin, and then we're also going to start on the first several disorders of skin, or the integumentary system. So for the first several slides, you're just going to take notes like normally, and then you'll answer some questions from a worksheet and submit it to me. But when we start the disorders, you have guided notes for those. So you're going to start filling in those guided notes today, and then tomorrow when we're finished, you're going to submit the finished filled in guided notes as your assignment. And I'll tell you when to switch over to those guided notes. So first of all, starting with functions. So functions of the skin. Skin's so much more important than it really gets credit for. So the first thing is that it protects us, right? So it protects us from injury, from germs getting in. Unless you have a cut in your skin, bacteria is not getting in, viruses aren't getting in. Germs and things like that get into cuts, or they get into your mouth, your eyes, your nose, openings in the body. But if you have intact, meaning non-broken, good skin, you're good. It also protects us from dehydrating, kind of like our saran wrap that keeps the moisture on the inside. And it screens out UV radiation. It helps block the sun's harmful rays to a point. You can overwhelm it and get it sick with cancers and things like that if you give it too much, but it does a pretty good job of blocking for the most part. Excretion, meaning you're getting rid of. You excrete means like to get out, to sweat out. So you excrete waste products through your skin. You also excrete in order to cool yourself down. So the number one way that your body cools itself down is to excrete sweat, and then that sweat evaporates. And when it evaporates, it takes a ton of heat with it. Your skin makes vitamin D. So sunlight on your skin converts this, the ingredients or a precursor to vitamin D into actual vitamin D. This does not give you license to go lay out for hours and hours. That is just asking for skin cancer. I think the last time I heard it took about 10 to 15 minutes worth of sunlight on just your hands and face to get enough vitamin D. Sensory function, because this is really the nervous system. Your nerves are how you feel things, but because of the nerve endings, the last part of the nerve that actually picks up on temperature or pressure or whatever, because those are in your skin, it goes with the integumentary system as well. So those nerve endings are responsible for your sensory function. Storage, it stores fat. Remember that entire subcutaneous layer is just fat. It stores a lot of water. That's about it. That glucose is a lie. And then absorption. So please don't confuse number 2, excrete, with number 2, absorb. So excrete is to push out and get rid of. Absorb is to soak in and take in. So your skin is capable of absorbing things. You probably know that every time you put lotion on it gets absorbed in. We use that to our benefit with certain medicines. For instance, nitroglycerin. Nitroglycerin is the medicine that dilates your arteries, and we give it to people when they're having angina, that chest pain, or when they're having an actual myocardial infarction, that heart attack, because we specifically want it to dilate the coronary arteries, the arteries taking blood flow to your heart. Now, it does it to all the arteries, and so we have them lay down so they don't pass out when their blood pressure drops, because it does it everywhere, but we're using it just for the coronary artery dilation. That is available as a little tablet that you dissolve into your mouth, as spray that you put under your mouth. But some people also have a nitroglycerin patch or ointment that they put on their skin, and it's absorbed that way. There are some birth control patches that are done that way. If you've ever gotten bitten by mosquitoes or fire ants or something that's really itchy, you know that there's probably there's Benadryl and hydrocortisone creams that you put on your skin absorbs, and that's why we can put medicine through it. So now the 3 different layers and kind of which function goes with what. So the epidermis being the outermost layer, the avascular dead skin cells on the outside, they're your big protection barrier. Because it's on the outside, it's what's really protecting you. So against germs and the sunlight, radiation, scratches, dehydrating, it's your protection. It has keratin in it. So you may have heard of keratin before. Keratin is a type of protein that is waterproof. That's what makes your skin water resistant. And now it's not necessarily waterproof. If you put your hand in a bucket of water, eventually it will soak in some of that water, and that's why you get all wrinkly and stuff. But it is water resistant. The same cells that make keratin, they're called keratinocytes, are the ones that are also making your vitamin D. It also has your melanin. So melanin, or melanocytes, which make melanin, is a protein that makes you the color that you are. So darker skinned people make more melanin, and us pasty folk make less melanin. And melanin is what protects you from UV radiation. So when you get tan, when you get darker, that's your body making more melanin to try to defend yourself from all the sun that you're coming into contact with. I had a teacher one time tell me that a tan is your skin screaming because it's trying to protect you from the UV radiation. Remember, it's dead, new cells are made at the bottom and they push their way towards the top. And as they get further and further away from the bottom layer, which comes into contact with the dermis, they get further and further away from any oxygen. So they die along the way. RIP epidermis. Avascular. Okay, dermis is that middle layer that has everything in it. So it has the nerve endings in it. So it's what's responsible for your sensory perception. It has the oil glands and the sweat glands. Remember, sweat was how you excrete things, but it's also the main thing that helps you to regulate body temperature. So perspiration is the fancy way for sweating. So we perspire, or we undergo perspiration. We sweat in order to cool ourselves off, to regulate our body temperature. And then the subcutaneous layer, which was the deepest layer, also called the hypodermal, was the one that stores half your body's fat cells. So half your body's adipose tissue is in the sub-Q layer. So it's your storage. It stores the adipose and all your vitamins that are fat soluble as well. Is it A, D, E, and K, I believe, are fat soluble vitamins, and so they're stored there as well. It also helps to bind your skin to your muscle, because it's what connects the real skin, the dermis, and then the epidermis, to the muscle below it. Hair is so complex and way more important than we give it credit for. It's not just to make us look cute. So protection, especially like eyelashes and eyebrows and nasal hair and things like that, help to protect us. Temperature regulation. If you've ever seen a cat get scared and how the hair stands up on end, hair stands up not only when you're scared to make you look bigger. That's what cats are doing. Isn't that precious? They think they can get big and scare us off, like, oh yeah, you're huge and now I'm so scared. So it not only gets big to make you look bigger as a defense mechanism, but it stands up in order to try to trap air under it and kind of be like a coat. It doesn't work well for us because our hair is so thin throughout our body, but other mammals, their hair is very insulatory. It helps keep body heat in. It also helps us to evaporate our sweat. So it picks the hair up off the skin a little bit and lets it become more exposed to air, which helps evaporation and convection, air blowing over it. The follicle shape that you have determines the type of hair that you have. So remember, follicle is a pocket, and this is just cool information. Don't worry about testing or whatever. But if your follicle, if the pocket your hair grows in is a perfect circle, it's nice and circular, then there's no pressure applied to the hair. And so as it grows straight. But if you think about it, if you've ever taken scissors to a ribbon to curl it, that pressure is what curls it. So if your follicle is more oval shaped or starting to flatten out, it puts pressure on the hair as it's growing. And the more pressure, the curlier your hair is. You also have melanin in your hair. So melanin was what determined the color of your skin. A different type of melanin also determines the color of your hair. In fact, it's also melanin that determines the color of your iris, your eye color. And we already talked about that. When you're cold, it stands up. That erector pili muscle contracts to pull the hair follicle up so that the hair strand pulls up, and it's to insulate you and try to keep your air in, your warm air in. Also, as people age, the melanocytes die. They stop producing melanin. And so instead of being pigmented, then your hair is filled with air. And that air looks white. And so that's why people's hair goes white when they get older. Old people are the real airheads. Da-doonch. Don't tell your grandparents I said that. Nails, they protect the nail bed. Bam, that's it. This slide's done. And then your two types of glands. So you had sudoriferous. Remember, sudor sounds like odor, so that's the sweat ones. Your sweat glands, the sudoriferous glands, are the main things for temperature regulation to cool you off. When you sweat, you perspire in order to cool off. It's the one that looks here like the garden hose or the snake that's coiled, and then it goes up and dumps into a pore. Sweat is 99% water. Remember, in the genital area and the axillary area, which is your armpits, there's a thicker form, and the bacteria feeding on it is what actually makes you smell bad, which is disgusting. Go take a shower. And then sebaceous. So sebum is oil, so sebaceous glands are your oil glands. So they make that oily substance called sebum that lubricates the hair and the skin. Certain times in your life, you make more sebum, like yo right now, and me for some reason. I don't know why I'm still pimply. It's not fair. In adolescence, an increase in sebum production, meaning more oil, can plug the follicle, because remember, all the oil glands dump into a follicle, the pocket that the hair grows in. And so it plugs it, and then it can lead to a pimple. So this is the end of the functions. So starting on the next slide, slide 10, you're going to be filling in guided notes, which I have given you today, but they are not going to be due until tomorrow. So there's a worksheet that you're going to do based on the last 9 slides. So the information up until here, it's a matching worksheet. And then start on the guided notes, but they're not due until tomorrow. So if you want to pause it and do the worksheet, you're welcome to, or just keep on plugging through, but go ahead and start filling out the guided notes. First disorder, acne vulgaris. How mean is it that the real name for acne ends in vulgar? That's mean. We can't help it. Acne vulgaris is just acne. So you make too much oil, too much sebum, and it mixes with dead skin cells and forms this plug, basically. So here's the sebum. It mixed with the oil, the oil mixed with dead skin cells plugs, and then bacteria is trapped underneath it. And so the bacteria ends up getting killed by neutrophils, and you get pus, and then that's a pimple. So the difference between a blackhead and a whitehead, which you don't really need to know, but just if you're curious, blackheads are oxidized. So that plug is exposed to the air, and the air changes it, makes it black. Whiteheads are like little pockets of pus. Because they're not getting exposed to air, they stay white, those dead white blood cells, and then you get that whitehead, that pimple. Really common in adolescence and at various points throughout your life. Mid-20s, again, a lot of people break out. Treatment. So it's twofold. Number one, things that decrease your oil, which is why most acne medicines dry you out. And then also things that promote skin peeling, because remember, the two things you needed were lots of oil and dead skin cells. So we dry you out, and then we usually exfoliate you. We do things to try to slough off all those dead skin cells. Just so you know, acne does not come from like eating greasy foods. I mean, if you take a piece of pizza and you wipe it on your face, yeah, absolutely. It's not, greasy foods or eating chocolate or anything like that. It's oil and dead skin cells. Athlete's foot. Oh, this is yummy. So athlete's foot is a fungal infection. It's very contagious. A lot of times you get it from walking barefoot in places that are wet. Fungus needs wet. It needs moisture. If you remember thrush, the fungal infection, the yeast infection in the mouth, that it happens in the mouth because of the moisture. So you need moisture, and you need to be barefoot. So walking around like in college dorms in the showers or public restrooms barefoot, ew, that's disgusting. So symptoms, it depends on the type of fungus. Athlete's foot is kind of an umbrella category. There's a lot of different fungal infections that we call athlete's foot, but most of them are itchy and scaly, either on the bottom of the foot or between the toes. Oh, disgusting. So that's athlete's foot. It's usually an itchy red rash. Sometimes they can blister if it's severe enough, like this. Oh dear, ew. Treatment is going to be an antifungal. So OTC means either over the counter. You can get over the counter antifungals creams at Walgreens and CVS, or RX's prescription. So if it's super bad, you can get a prescription for it. Best way to prevent this is, first of all, don't walk barefoot in public places. And secondly, wash your feet. So keep them clean and dry, and don't borrow things from people. I mean, like towels or socks or things like that, or shoes. Ew, disgusting. No, no, no. All right, burns. So the last thing that we're going to talk about today that you should be putting on into your guided notes that, again, we will finish and or do tomorrow, are burns. So there's 3 different types of burns. You got 1st degree, 2nd degree, and 3rd degree burns. And you see the picture here. This is a 1st degree, that's a 2nd degree, and that's a 3rd degree. So we're going to go through the difference between them. 1st degree burn is where they call them superficial burns. So they only affect the epidermis and really only like the top layers of the epidermis. Symptoms are it's red, it hurts, and it may or may not be a little bit swollen. So usually it's swollen, but it may not be so badly swollen that you can tell by just looking at it. This is a perfect example of a 1st degree burn. Most common 1st degree burn is a sunburn by far. Oh, honey, poor thing, tuck that tag in. Treatment, well, best case scenario is you put on sunblock and this didn't happen in the first place. But once it's happened, you need to run it under cold water. Do not run it, don't put it like in icy water. You don't want it super, super icy cold because that could damage it more. So just run it under cold water. And they usually say for like 15 to 20 minutes until it stops hurting. Basically, the heat stays in there for longer than you think. And so it's continuing to burn you. Kind of like when you take cookies out of the oven about a minute or 2 before they're done because they'll keep cooking on the inside even after they're taken out of the oven. Same thing happens with you. We are all just cookies. So you run it under the cold water to help kind of suck some of that heat out. And then take pain medicines because, ow. 2nd degree burn. 2nd degree burn we call partial thickness burn. So it affects all the way through the epidermis and down into the dermis itself. The symptoms are you have that same redness, you have the same pain, you have the same swelling, but you have blisters. You have to have, this is key, blisters, blisters, blisters. You have to have blisters for it to be a 2nd degree burn. That is a 2nd degree burn. A lot of 2nd degree burns come from, and it looks like this one has as well, scalding water, oil popping on things. So this looks like oil that has gotten on this person. The oil isn't there though. What you're seeing is blisters. It's just the shape of where the blisters are is what is making me think that it was from a liquid burn. Treatment, cold water until the pain stops. Again, like 15 to 20 minutes. Do not pop the blisters. I know that it is so tempting to pop them. It's like bubble wrap. You just want to pop it, but no, because this is still intact skin. And so there's no increased risk of infection until you pop it. Once you pop it, bacteria from the outside world can get up under your skin then. And so it comes with a huge risk for infection. You should cover them with a loose, sterile dressing, like a loose, sterile bandage, if they pop, or if, say, this is like right where your bra line is, or right where your clothing is going to rub on it, you can try to protect it with a dressing so that they don't pop. But make sure you put like some sort of ointment or something so that the dressing itself doesn't stick to it and pop it. Don't pop them. If they are more than 2 to 3 inches of your body, then you need to go see a doctor because of the risk of infection. 3rd degree, and the last one we'll talk about today. 3rd degree is full thickness. It goes through the entirety of the dermis. So symptoms, no pain. Why would there be no pain? What was it that was in your dermis that let you feel things in the first place? Nerve endings. And guess what? You just burned them away. So there's no pain. It could be numb. Now, everyone, if you have a 3rd degree burn, if a patient has a 3rd degree burn, it doesn't exist by itself. It's going to be surrounded by 2nd degree and 1st degree burns. So where the actual 3rd degree burn itself isn't going to hurt, but the rest of it, the rest of the body, everywhere around there is still going to be horribly painful. It looks stiff. It looks white or black and leathery. So I'll show you a picture here. Super sorry. So this is a leg and that's a knee. The patient's laying on a bed and this is their other leg kind of bent up behind them. So you are seeing nerves here. Those are nerves that you're seeing. The black is obvious. Let's see, did I put another? No, I didn't. So sometimes the white is because, like, if you ever watch fire burn or wood burn, like in a fire, you know, like it looks like ashy on the outside. So that's where the white can come in. Treatment, I mean, obviously you're going to go to the hospital for this for a lot of different reasons. First of all, you need IV fluids. Remember that your skin was keeping all your moisture in. So these people are going to dehydrate because you've lost that barrier and you've basically evaporated the moisture in this area as well. And then they have another thing that happens where fluid, there's there's a fluid shift in it. So they're at super high risk of dehydration. So they're going to get IV fluids to keep them from going into shock, because it's basically the equivalent of bleeding out, even though you didn't really bleed. Antibiotics, because obviously this is at a huge increased risk for getting infected. Debridement. Debridement is all this black stuff. If you don't get it off and get rid of it, it's going to rot, and then the leg's going to rot and they'll become septic and they'll lose the leg. So basically we have to like pressure wash this. So a couple different ways. If it's over a large, huge part of the body, we can put them to sleep and we like pressure wash it to get it off, to get it clean, because we want it to look this like nice pink meaty stuff. We can also do what we call wet to dry dressings, where we take gauze and we wetten it and we put it on here, and then we let it sit there and dry and kind of become one with the skin, and then we rip it off. Obviously it's super painful. Numb up the area or put them to sleep before we do it. Lots of pain medicines, because this is going to be horribly painful. And then skin grafting, where we can take skin from other parts of the body and try to replace it where it's burned away. So again, first degree burn, just a superficial burn, we call it. Second degree burn, remember these ridges are the dividing line between the epidermis and the dermis. So it's gone all the way through the epidermis and down into the dermis. And then third degree burns have gone all the way through both. They can even go into sub-Q or burn down to bone as well. So one of the things that we'll have to do in the field, you're not going to have to do it for your test or anything, but I just want you to have heard of it. In the field, we have to quickly try to assess or estimate what percentage of the body has burned. And so we call it the rule of nines. This only works on adults because babies have tiny little legs and huge heads and trunks. Their body is different. It's proportioned differently. But so for adults, the entire arm is 9%. So one arm, the front is 4.5, and then the back is 4.5. And then the other arm, the front is 4.5, and the back is 4.5. So each arm, the entire arm, is 9% of the body. So if you have one entire arm, front and back, burned, that's about 9% of their body that was burned. Same for the head. The front is 4.5 and the back is 4.5. So the entire head is 4.5. Each leg, the entire leg is 18. So the front is 9% and the back is 9%. So the entire leg would be 18. And then the trunk of the body, being the chest and the abdomen, the entire front is 18 and the entire back is 18. So that would be 36. So each entire arm is 9, each entire leg is 18, and each entire trunk is 36. And then the leftover is the 1%. We call this area the perineum area. It's where the genitalia are. Even if that's the only thing that's burned, it's a severe burn. Also, anything that bends. So if you burn an elbow or on your fingers, your hands, or anywhere on your face, anything that bends, your face and your genitalia are all immediately severe burns that you need to go to the doctor to have treated. There you go. All right, that's it for today's notes. Make sure that you are putting these into your guided notes. Tomorrow we're going to finish disorders, and then you're going to submit these filled out guided notes to me as your assignment for the day. For today, you are doing the functions worksheet and submitting that. All right, bye guys. Hope y'all are doing well. Miss y'all. Stay safe, stay healthy, stay happy.